when you're at an executive level, you need to step back and look at the bigger picture and understand that it's really these three major areas that we're moving toward, and we're moving from this more government run, government design system to a market based system, and it's going to be really tough.
Welcome to Success in Chaos, a healthcare podcast where each episode is dedicated to unlocking success amid rapid change and uncertainty. I'm Angela Adams, the CEO at Inflow Health.
And I'm Kandice Garcia-Tompkins, Quality Improvement Director for the ACR Learning Network and owner of Tungsten QI Partners.
We are so excited to have Blair Childs on today. Blair is the CEO of Childs & Associates, a DC-based firm that provides strategic guidance, advocacy, and communication support to leading healthcare organizations. For more than 4 decades, Blair has been at the center of healthcare policy in Washington, shaping legislation that impacts nearly every sector of the system, from hospitals to insurers to medical device to pharmaceutical companies. He previously served as a member and executive team SVP at Premier Inc., leading public policy and advocacy, thought leadership, communications, and government services and marketing. Blair is widely recognized for his ability to anticipate where healthcare is headed and help others prepare for it. Welcome, Blair, and thank you so much for being here.
Thanks, Angela. Great to be with you and Kandice.
Perfect.
Wonderful. Well, Blair, to let the audience get to know you a little bit before we jump into your vast level of knowledge, we like to do something called Two Truths and a Lie. So you're going to tell us 2 things that are true and 1 thing that's a lie, and Angela and I are going to guess which one is the lie.
Okay, so here they are. I ran for Congress in the 1990s in my home state of Connecticut and tried to make it work, but I did not get enough votes to win. That's one. Second one is I met with Donald Trump in the cabinet room of the White House, along with about a dozen other healthcare leaders back in Trump #1, first time around. And the third one is I've been involved in all of the major healthcare reform efforts in really pretty pivotal positions, including the Clinton healthcare reform debate, the creation of Medicare Advantage, the drafting or the development of the provisions in the Affordable Care Act, as well as all the interoperability legislation that's been passing in Congress over the last decade. So what do you think?
What do you think, Kandice?
That's a tough one. Those are all very detailed descriptions. I'm going to go with did not meet with President Trump in the first.
I'm going to go with the first one. I don't think you ran for office. I think you're too smart for that.
Angela, you win. I
Yes.
did move back to Connecticut to run for office, but the opening I was hoping was going to appear didn't appear. So I was working for Aetna, running their public affairs area, and at that time, and it was 3 miserable years of my life. So.
I was going to say, how did that go? Yeah. Honestly, that's a perfect segue for me. Blair and I have been friends for a few years now, met him through a CEO advisory group, and was just blown away. I'm going to brag about Blair for a few minutes here. Was just blown away. I think it takes a very special skill set to sit in Washington, understand everything that's going on, and be able to make application and kind of predictions even on how this is going to impact healthcare, especially in the current climate and landscape. There's been a lot of bouncing back and forth in DC for a few years. Not that that has ever not happened, but I think it's become a little bit more, let's say, chaotic over the last couple of years. We have this wonderful podcast here called Success in Chaos, and we have people on, Blair, that are really trying to drive success through the chaos of the healthcare system. From the 1990s to today, there's never been a moment that healthcare has not been in some kind of state of chaos, whether it's coming from government or regulations, or whether it's coming from something like COVID-19. But I think we are in this kind of period where it feels like another swirl of chaos, especially even coming from Washington, D.C. So my first question for you is really like, how did you pick to be in this industry? You're so phenomenal at it, but how did you end up where you are today?
Yeah, yeah, it's really strange, but it says something about my strengths and weaknesses, I guess. But since I was a little kid, I literally was always interested in public policy. Believe it or not, like I was 5 years old, 6 years old, and I was thinking about this stuff. Believe it or not.
Really?
Yeah, I just have always been very interested in sort of history and how things came to be, and then and because I'm very entrepreneurial, I when I went to Washington, and I just went to Washington in the early '80s without a job or anything like that, and
Wow.
I just started working. I was thinking I'd work on Capitol Hill, but I didn't. I ended up working in an association, and I just uh, starting and running associations and different organizations and advocacy efforts. So um, I I founded and ran the American Tort Reform Association back in the late '80s, and we got legislation passed in 41 states.
Holy cow.
I then went to Connecticut, where I was thinking of running for Congress, but that didn't work. And I was working for Aetna, and I then went back to DC and started working for the Health Insurance Association of America. And I ran its program that was opposing the Clinton healthcare reform debate. It was very famous, the program that I ran, which was a national advertising program and everything, and it was a major first of its kind of a campaign. But there were a lot of concerns with the Clinton healthcare reform debate. It wasn't just that program, but that program was very pivotal in changing that. Then I started my own business, and one of the things I was doing was working with the Healthcare Leadership Council, which works with all the different sectors in the healthcare community. So, pharmaceuticals, insurance, device manufacturers, you name it, all hospitals, everybody was involved in that organization. It was all the CEOs of these organizations. It's like the business roundtable, but it was across healthcare.
Yeah.
And, we ended up working very closely with Newt Gingrich and the Republican Congress to create Medicare Advantage. It was at that point Medicare plus choice, but I ran the national campaign on that. So that led to the creation of that program. But I have to say, I've always really tried hard not to be partisan. This sounds
Yeah.
partisan when you talk about Newt Gingrich, but I also then after that I was the number two person in the device industry association, AdvaMed, and really created a lot of what AdvaMed is today. Um, and then I went to Premier and worked with Premier for a number of years, which again is a health system organization who's working with 4,800 hospitals, but
Yeah.
some of the largest health systems in the country. And I was running their public policy area, their marketing, communications, thought leadership, government services, a number of different programs for them. And we were really at the forefront of the movement to value-based care. So I ended up writing a number of the provisions in the ACA related to value-based care and trying to move to a solving the problems within the healthcare system through the providers. A provider-led transformation of our healthcare system was what I was trying to achieve. And it's very similar in many ways to Medicare Advantage, because Medicare Advantage, at least the concept was total cost of care models, where basically somebody is accountable for the total cost of care. So And I was hoping more health systems would move that way, but some have, some haven't. That's really what's going on in healthcare. And the
Yeah.
thing is, when you say how chaotic the system is, so when I was with Premier, I did a number of things, but we were very much a leader in Washington in terms of value-based care.
Oh, of course. And this is the premiere out of Valentine, right?
Yeah. Mm-hmm.
Yeah. Okay.
But we really we were sort of known as a very, very influential organization at that time. So it was great. But the thing that when you talk about the chaos in healthcare, and I think the way I would describe what's going on is we are moving from what was really designed as a government, really a more government run healthcare system. And that was with Medicare and Medicaid in the 1960s. And that system, government can't run things very well in our system, the way our republic works. We have states that are very involved in all government. Then you have the federal government, which really is very weak in many, many ways. And so it was given all this authority to run Medicare and Medicaid. And initially, that's the way it worked. Medicare was run entirely by government. So we had CMS, we had the states running Medicaid. And now, how does it work? It's not that way at all. You have Medicare Advantage, which is more than 50% of the Medicare lives, and you have states that have basically contracted out to private plans all the Medicaid program. So we are going through this massive change from a government-designed system to a more market-based system, which is what really our republic was designed to encourage, was a market-based solution in the way things work in our economy. And it's very hard. It's just been, the change has been dramatic. And then what's made it even tougher now is things have become so partisan and so much you hit one person and they hit you back. So everybody's doing this kind of an approach because there's not this sense of we're all in this together. There's big ideological differences, although I would say in healthcare there's a lot of common ground, and that's what people need to focus on, is the common ground.
I think more so than anything, just you've been in this since the 90s, right? Or maybe the 80s, I think you said at one point. So we don't want to, give away your age or anything, but you've been in this from the 80s.
No, you did.
There's a lot more, back and forth, punching and hitting. I agree with you. I think people are closer in their thought process and how they think about healthcare than they are farther away. But it feels like from a distance, like everybody is like in a punching match. Like, what do you see kind of feet on the street in Washington? Are people closer than we think, or are they truly that far apart?
There's a lot of common ground. And this is how I try to help people think about this. There's three major areas where you need to that's the framework you should be thinking about what policy is being done in. And they are very clear where we are moving, I think. One is moving from government design to a market-based system where somebody is accountable for the total cost of care. So when I say the total cost of care, it means somebody's really responsible for the financial, costs of the care, the outcomes for the patient, and really making it all work together in some way.
Yeah.
I still think providers should be the ones doing that, but there's,
I think they've had their opportunity and they haven't taken it.
I think some have. Yeah. There are clearly some health systems who have. And I think they're the leaders and they're going to be the winners in the end.
Is it still about 30% that have taken up the value-based care kind of model and about 70% that are still fee-for-service?
That's correct.
Okay.
Although I wouldn't say there's still fee-for-service, because fee-for-service is never going to go away. You still have to pay for people doing services. It's more a question of how you organize yourself. Are you going to have the total cost of care? And that's really a capitated total cost of care payment. That's how Medicare Advantage pays for care, is they pay a capitated payment. That's what ACOs do. They pay a capitated payment. So that's one thing. Second thing is fixing a lot of the perverse incentives in fee-for-service today. Because as I said,
Good
fee for
point.
service isn't going to go away. It's just that it has a lot of very perverse incentives. And that's everything from the way 340B has been, you could say, used by health systems to their advantage because we're smart business people and you're going to take advantage of a system. But in the same way, you could say Medicaid. And this is why the big, beautiful bill attacked Medicaid, because you had this huge variation across the states with provider taxes and state directed payments that caused real differences in an uneven playing field. And you can't have a competitive system if you have an uneven playing field. So
Agree.
fixing these fee for service perverse incentives, getting rid of these advantages for one provider group over another, that is a major thing that is going to happen, and it's happening. And this legislation actually accelerated it in some areas, but there'll be more coming. There's just more that's going to happen. And the last thing is consumerism, and that's access to data. It's access to your personal health record. It's access by insurers as well as providers. It's really the free flow of information and to help consumers make better choices and really vote with their feet much more than they are today. So those are the three major trends, and that's the framework I encourage people to think in terms of what's going on, and that's where we're going. It's just a question of how fast it's going to happen because healthcare is very delicate. It's politically fought over. It's always going to be politically fought over because, people care about it. They vote based on it. They're scared if they think that they're going to lose their health care. And so it can be used as a scare tactic. It's been used as a scare tactic going back forever. And let's face it, elections are about scaring people. They really are.
You
So
know, oh, Blair, I think that is the clearest, most visual understanding of the complexity of this transition that I think I've ever heard. From the front line, which is where a lot of the work that I'm doing with the frontline staff and management and leadership, it is so hard to understand how those things are shifting and moving when we are feeling kind of the effects of the tiniest little bit from an exam code to a CPT code to, rescheduling exams and interacting with patients and each other in an effective way. That framework actually provided a ton of clarity for me to say, oh, okay, those are large models that are shifting. And this disconnection at the front line is actually because the model shifts. Now, can you help me understand? We've been talking about the big, beautiful bill and all this legislation that's going to be affecting the payment structure. I'm kind of understanding now that that is part of that shift. But what can we expect? There's so much information out there, like you said, scare tactics and fear mongering and propaganda. And it's so hard from the population level to kind of understand what is even happening. Is this something that we want? Is this something that we don't want? What would be the effects? Can you kind of help us, understand a little bit about what are the downstream effects from this shift, and what are the things, if we're going to be voting for our future, what are the things we need to be considering?
Oh boy, that's so. Kandice, you just asked a huge question. I guess the thing I would say is there's different levels, obviously, of detail you need to know. And my point to executives is you need to understand that larger context. And this is where reforms are bucketed. And believe it or not, this is bipartisan. This is happening. All the Democrat states have moved to managed care organizations running their Medicaid programs in a capitated program. So the Democrats have moved in that direction just as much as the Republicans have. And in fact, many of the Democrats are some of the biggest advocates for Medicare Advantage today because Medicare Advantage is attracting more poorer segment of our population. Actually, the largest number of people going into Medicare Advantage programs are poorer people, and they tend to be more of a constituency in more urban areas where the Democrats are. So things have changed a lot, but you need to understand the details, like you were saying, Kandice. If you're working on coding and payment and revenue cycle and all those kinds of things, which are just the nuts and bolts of this system. You need to really understand how those work, those mechanics work. But when you're at an executive level, you need to step back and look at the bigger picture and understand that it's really these three major areas that we're moving toward, and we're moving from this more government run, government design system to a markets-based system, and it's going to be really tough, and it's going to change. It's constant change. And based on the way you structure your organization. So if you're an organization that is what I call a payvider, where you're both a provider as well as managing payment. So you've got a payment side. You may have an insurance plan. Like look at Intermountain. They have Select Health. They've also got one of the finest medical care systems in the country. You could look at Banner. They're the same way. There's a number of organizations that have this. Kaiser is the foremost of these, which is a payvider. But even HCA, a for-profit entity, they in so many ways are preparing themselves to be in a position to succeed in a new value-based accountable system, and they are building their structure to do that. They see this coming. They're still operating in fee-for-service, but they've said they're not going to try to be a payvider. They're going to instead be the top performer in the provider delivery side. We're going to be more accountable with higher outcomes at a lower cost than anybody else. But the thing is in the system, and this gets back to the perverse incentives, you've got for-profits and not-for-profits. That's an uneven playing field.
Yeah.
So what Donald Trump is trying to do, and the Republicans are trying to do, and the Democrats too, are trying to level the playing field. And so perverse incentives is really about leveling the playing field. And there's a whole lot of different areas that you could talk about that in, from site neutral payment to, total cost of care models and the way they're structured.
I think one thing that I've learned from you, I've watched your presentations for years now, is that there's really pros and cons in every legislation that goes through. I think Big Beautiful Bill definitely has some pros and cons. In your last edit, of course, I'm not sure. I feel like very fortunate to be on your list of people that gets your edits, but you bullet pointed several really key things that are coming out of the bill. One thing that I think that we've heard a lot of fear around is the Rural Health Transformation Program. I would love to know from your perspective. Obviously, I have a near and dear place in my heart for rural hospitals and health systems. I would like to understand, you've got a whole paragraph here that I won't steal the thunder on, but what do you think is going to happen with rural-based health in the next 2-3 years?
Well, this is something where, again, everything has got its strengths and weaknesses, its opportunities and risks. The Rural Transformation Fund, which is $40 billion, it's half of that, so $20 billion of that is going to go, $50 billion.
Yeah.
What am I saying? Is half of that is going to go to the states, and the states are going to, have to get a plan done. The thing that's interesting is that they're already saying they want to get the plans in fast so that people start planning and doing things with this money. I think it's an incredible opportunity, but it really needs to be focused on, key things that are long-term, which are how do we build an infrastructure with telehealth and other kinds of ways of delivering care, which increases access and increases the care that's delivered in these rural communities. And the Republicans are very focused on the rural side, much more so than the Democrats, just by political constituency. So they really want to do something here. This is an incredible opportunity. People should be stepping up right now. And the thing that I have found is so many health systems, they're sort of their head is spinning because of this bill that just passed, and they're trying to figure it out. They need to understand the bill. They need to understand all the details in the bill. They need to have somebody really strong who is helping them put together a game plan. a game plan to figure out how they're going to work within the confines of this bill, because it rolls out over different timelines. And the Rural Transformation Fund is the first thing up. You ought to be on this like today.
Yeah, it says that the funds start in January 1st, 2026. So
I think they're going to start sending money out to states after the start of the fiscal year, which is October 1. I think states can get money that early, and I think they're going to make it available. So people should be busting their butts right now, putting their plans together.
Yeah, I think that's
what I've been telling people.
That's a really important kind of it. Though the shift has been that much of this is moving to a state level to decide, it's like, are the state levels ready? And I think that's a very good point that you're making. So people getting in touch with their state representatives and making sure that they're active in that, I think, is a very important part of this.
Yeah, and making sure you're in the governor's office, you're making the point. And I was just speaking to a health system last week, and their board and their senior management, and these are the points I was making to them. They can't, and they're right in the middle of the rural community. I mean, one of the most impacted areas in the country, and they should be all over this.
Yeah. So there's money that's there, that's available, that's ready for action plans, is what you're saying. I think your first question on here was exactly that. Who will be working with your state's Medicaid office to protect against the impact of all of these reforms and model different policy responses? And that's a great question to bring up.
And I also think, because public policy is always changing. So this bill that was passed is going to be the center of the 2026 election. So there will be a referendum on the bill, and we'll see what happens. Right now, if the Democrats take the House, or it's harder for them to take the Senate, but if they take the Senate and the House, that is going to send a very clear message, and you're going to see adjustments to the law. Yeah. If they don't, anyway, we could game out all these different eventualities. My point in saying that, though, is people should be benchmarking where they are today in terms of access, in terms of care, in terms of the services they're providing, and making sure that they're tracking how the law rolls out and how it's impacting care in their communities. And they should be trying to impact it right now at every step in the equation. We talked about the Rural Health Transformation Program, but there's a lot of other elements.
Yeah, I agree. I want to land on this question right here and kind of end with this. If you could wave a magic wand, so you have one, right, Blair? You've got a magic wand. Change one regulation or policy to reduce chaos and improve healthcare delivery, what would it be and why? Yeah. Magic wand, one wish.
I would really accelerate the movement to value-based care and accountability, total cost of care models. And because, but the challenge is you can't do that because it's too disruptive.
That's right.
But it's happening slowly, and it's going to continue to happen. And so that's what, if I could accelerate that, that's what I would do.
Kandice?
I mean, I feel like I could do this for another 2 hours. Thank you, Blair, for sharing just like what you have. I mean, I've learned so much just over this little bit of time that helps us, I think, understand, like you said, like from the nuts and bolts, the operational levels, the ground floor, what shifts do we need to make? And what I'm hearing is that it is actually a shift in identity of who we are and how we show up in our communities. And then redefining the funding sources or reconnecting with the funding sources in a way that actually serves the mission of the administration, the vision of the funding and the shift, but also the vision of the healthcare organization, the patients and the staff. I'm going to take so much.
I really like that, Kandice. I like what you just said. Yeah.
Thank you. I'm going to take so much away from this. Now, you are so smart in so many ways. Do you have any recommendations for books or things that we can make ourselves more knowledgeable or that would help us become better experts in this arena?
Yeah, it's, I was thinking about that because you warned me you'd be asking something like this. I read biographies, and so I like history and I like biographies and stuff like that. So, I Walter Isaacson, books, and Stephen
Love them.
Ambrose and John Meacham are people I've read their different books on different historic figures. But I guess what I feel like is because we're living in such a dynamic, changing time, you really have to just dig into the primary sources and understand what's going on right now. So the big beautiful bill, understanding that and making sure you get
Mm,
people to help you understand that and what the timelines are, what you should be planning for, what are the things that you've got that you should have in place now.
mm,
So to me, it's there's I like to read about the history of our country and who the great leaders have been, and I'm always interested by that. But I'm encouraging people right now to be very focused on the here and now and really understanding it and making sure you've got people assigned to address the different parts of it that of the bill and what's going on in healthcare so that you've got a game plan in place to manage all the different changes that are going to be coming because they're not going to stop.
Anybody out there doing a good job breaking down big beautiful bill for like healthcare impact that you feel like you guide people to a lot of times? Is there
No,
like,
it's really, I that's what I try to do. That's really what I try to do because
yeah,
but the problem in healthcare is that everybody is a partisan and they're either advocating for their particular constituency in DC because that's what you do and you're defending the status quo effectively. And that goes for all the different interest groups in healthcare.
yeah,
There aren't many people who can step back with experience to know how the policy process will unfold and what's going on. I just encourage people to be very level-headed about it. It's
yeah.
it's
Well, you're about to get real busy because we're about to send all these people to you then. So are you ready? Everybody
yeah,
who hasn't talked to Blair, I think you need to be on the phone. Blair's phone's going to be
happy to.
ringing off the hook. Thank you so
oh,
much, Blair.
Thank
Candice?
you. Great to chat with you
yes.
guys. Really fun.
Oh, this was such a great discussion. Thank you, Blair. And thank you to our audience for joining us on Success in Chaos. Please be sure to like, follow, and share today's episode on Spotify, Apple Podcast, YouTube, or wherever you get your podcasts. And a special thanks to the Inflow Health team for their production support.